I'm a nurse at the International Heart Institute, and for many years I've been working with patients after they've had some problems with their heart, after they've been hospitalized, to prevent them from coming back in the hospital with more problems. And as our doctors say, if you listen to Sally, she'll keep you off my table. So what I like to do more is to come and talk to women, such as this group here in the community. I go all over. I've been all over the United States giving talks to raise awareness of the risks that women are at with heart disease, and this is really my passion. So, getting started, I thought my mother just passed away a few weeks ago, and it really has made me think about, she would have been 94 in 2 weeks. And she loved to tell me that she never owned a pair of tennis shoes, she never exercised, she did everything supposedly wrong, and yet she lived all those years. But she had very good genes, which a lot of us don't have. So I thought, in honor of my mom, I would talk a little bit of how important all of our hearts are first before I go into some talk about cholesterol. So I started thinking about what I thought about heart the first time I thought about heart when I was a child. Can you think back of the first time, and did you actually think of the picture of the heart, or did you think of this symbol that I have up here? And what I first remember thinking about were those wonderful See's candy boxes, and how wonderful it was when I saw those on Valentine's Day, because you know how good that chocolate's going to taste inside. So today we're going to talk about how really wonderful our heart is. And so let's talk about traditionally, this is the shape that a lot of us see on TV, particularly now that Valentine's Day is coming up. And the European traditional art and folklore, this is where what the symbol of the heart came from. It's a symbol of romantic poetry for Valentine's Day. It's typically red. It denotes passion, strong emotions. I didn't wear my red today. I usually have my red dress on, but I thought today I'd be more conservative. He made me take my necklace off, so I don't even have my heart necklace on now. The Bible tells us that the heart is the organ in the body with divine powers and related to God. The heart is deceitful above all things and desperately wicked. God is the judge who tries the human heart. And in Exodus it says God is talking about Pharaoh's hardening his heart and the heart of his officials. But what I really love is this verse in Proverbs, especially since this is what I do for a living, is that a merry heart does good like medicine. And my favorite quote is from Helen Keller, that the best and most beautiful things in the world cannot be seen nor touched, but felt in the heart. So as women, we're passionate, we really do a lot for others, but we can't forget that unfortunately, heart disease is what is the #1 killer for most of us, and it's in the world. It's not just in the United States. Did all of you know that? You know, the breast cancer people have done a wonderful job. We all know what that pink emblem is. Does anybody know what the emblem for women and heart disease is? What? The red dress. So when you leave here today, I want you all to know that whenever you see a little red dress pin on anyone, that is to raise awareness of how much all of us are at for heart disease. Heart and stroke disease is the #1 killer of women over 35. More than 1 in 3 adult women has some form of cardiovascular disease. So all of us in here that are over 35, 1 in 3 of us already has disease that we don't know about. And this is the worst thing, and this is why it's so important that those of you that are sitting here, 64% of women who die suddenly of a heart attack have no previous symptoms. And I'm going to talk a little bit about how that can happen. So while the dress is to die for, the message is to live for. So when you see this, and it's coming up Heart Month, the first Friday of February is the National Women's Awareness for Heart Disease. And if you go to Macy's on that day and you have a red dress on and you tell them you know about that, they give you 10% off. So remember, the first Friday of February. So what does the heart look like? Not like this, right? Our own hearts. It's not very pretty, but it is something, if you think back, that your heart has been pumping before you were born. And it faithfully keeps pumping every minute, every hour, every day. And it essentially, do you all know where it is? It's right here. And you know when you say the Pledge of Allegiance, you know your heart's kind of shaped like a football. And when you say the Pledge of Allegiance, that's the bottom part of the heart, the tip of the heart. And the upper part is up here where your fingers are. So it's kind of shaped like a football. So it's located right here on your chest. And what does it do? It's a pump. It pumps blood out to all the vessels in your body. It's about the size of your fist. Now, did you know that men and women, that our hearts are different in size, and our blood vessel system, as women, our blood vessel system is smaller than men's, and our hearts are smaller than men's, which you think logically it would be. When they were first developing the stents, you all know what a stent is, to put in the coronary arteries to open it up when someone's had a heart attack or has plaque in there, they only tested the stents on men. So when women started having heart attacks and they tried to put a stent in women's coronary arteries, guess what happened? It didn't work because they were too big. So the red dress, the awareness of women and heart disease, they did research on women and they developed stents that fit our vessels. Does our heart ever stop and get to rest? No. How many times does the heart beat? How many times does a normal heart beat in a minute?
Approximately 70.
Very good. She gets an A. But did you know this? 100,000 times a day. That's resting. That's not when we exercise. 4,300 gallons of blood each day is circulating through at rest. At rest. You know those guys that just climbed El Capitan? Can you imagine what their hearts were pumping of the blood when they were doing that? I mean, it's really incredible to think of what our hearts and how faithful they are for us. So how much blood is in the body? Who knows? Yeah, right now, just blood, total blood capacity in your body. Does anybody know? About 6 quarts. About 1.5 gallons. In 1 minute, the heart pumps this around 3 times, meaning it's going through every minute, the blood is going completely around my body 3 times every minute. That's at rest. And of course, it's going to pump far more when you're exercising. In 1 day, the heart efficiently pumps 4,300 gallons of blood. So the average heart beats 70 beats a minute. So if you multiply that times an hour, you come up with 4,300 heartbeats in an hour. If you multiply that times a day, that's where the 100,000, at least, that's without exercising a day. If you multiply that times a year, look at that, 37 million beats a year. If you multiply that times 10 years, 368 million heartbeats. If you multiply that times 5, you end up with 1.8 billion heartbeats in 50 years, and my mother now almost was double that. Isn't that something? And we just take this organ, this little organ we have here, for granted as women. So, you're all here because of my topic probably. Have any of you heard me talk before? No, okay, so my passion in life is to straighten everyone out about cholesterol and heart disease in general and what you need to be careful of. I don't mind if you interrupt me. I can't see very well with this light in my eyes, so you'll have to call my name out if you have a question if I don't see your hand. So coronary artery disease, that is the disease of the blood vessels on the outside of the heart. We're not talking about the heart itself. We're not talking about the valves or the different chambers. We're talking about the blood flow on the outside of the heart. So the buildup of cholesterol and other deposits in the walls of the arteries that feed the heart muscle is what is coronary artery disease. It's a progressive blockage resulting in the heart muscle not getting sufficient nutrients that it needs to meet its needs. So cholesterol, that term, is something that we have to have. If you were born without cholesterol, you would die. You have to have it. It's made in our livers. It's made in the livers of animals. So whenever you eat anything that is an animal, you are eating their volume of cholesterol. We ourselves in our livers make cholesterol, and we have to have it to make cells, hormones, and to digest fat. So one of the things I want to make sure you know when you leave here is that cholesterol and fat are not the same thing. Okay? People get very confused on that, and the food industry loves you to be confused because they want you to eat their food. So I'm gonna help you with that. So where does cholesterol come from? The majority of cholesterol comes from our liver that we make. That's why someone that is a vegan that eats no animal foods at all, they make cholesterol every day, and when they get their lab test done, they still have a total cholesterol, a good and bad cholesterol, because their body is making it. So if I didn't let anybody out of here and we were in here for a week and we all ate exactly the same amount of food at the same time, and I measured our blood cholesterol in a week, would we all be the same? That's really, really important, because when you change your diet plans that the doctor wants you to go on a diet and lower your cholesterol, lower your saturated fats from animals, and you go in and you have a test, and let's say you have a significant other and they've done the exact same you have, and theirs has plummeted down and they're dramatically low, and yours has maybe even gone up, and you say, this is not fair, and this is because of your genetics. And we'll talk a little bit more later about how you can change it. But basically, cholesterol, whenever you eat anything from an animal, you're getting cholesterol from that animal. But when you eat saturated fat from an animal, bacon, cheese, butter, ice cream, cream cheese, sour cream, those things, the fat in the animal fat stimulates your liver to make cholesterol. That's why you can be on a diet that's low in cholesterol, but if you're eating a lot of saturated fat from dairy products and animals, your number could be higher the next time, even though your cholesterol intake is low, because you've stimulated your liver to make it. Does that make sense to everybody? And the food industry's done an excellent job to trick you, because you think you're eating a food less than cholesterol, but it may have a lot of saturated fat in it, such as I have a lot of patients that eat turkey bacon because they think turkey bacon is less fatty than pork bacon or beef bacon. It's the same. The body doesn't care. And if you think about hot dogs, if the next time you go to the grocery store, you look at the hot dogs. We have beef hot dogs, chicken hot dogs, turkey hot dogs, pork hot dogs, blessed by God hot dogs. If you flip them over and look at the saturated fat, it's exactly the same. The only hot dog that's safe is the non-fat, which nobody likes, or the pretend hot dogs. So that saturated fat, whether it's a turkey fat, a chicken fat, pork fat, it does exactly the same thing to your liver. It stimulates your liver to make what? Cholesterol. Very good, very good. All right. So every day we have this genetic program that tells our liver to make a certain amount of cholesterol. It goes all over our body, circulates around, and at the end of the day, what you didn't use to make cells and hormones and digest fats, it lands where? You know where it lands? In the coronary arteries, in the wall. So the bad culprit is the LDL, and you think of that as lousy. You don't want the lousy one. You want it as low as possible. So what should your numbers be? Did all of you get yours tested today?
You know what? I was wondering, where do we get them tested? I saw that, but I didn't know where that was.
It's in that main room.
In the main store, all the screening things are. Thank you.
Yeah, and you all should. Do all of you before today, did all of you know what your cholesterol was?
Yes.
Okay, at least you're being honest. Good. So we all should know what our cholesterol is. You know what I find? Oh, yes, go ahead.
February 2014, my cholesterol was 180.
Mm-hmm.
Diagnosed with breast cancer, went through chemotherapy, radiation, had a physical in December, cholesterol is 300.
Yeah.
I eat very good.
Yeah, it's stress.
Was it stress?
Yeah, the stress. They've done studies of CPAs, and they've looked at their cholesterol levels starting in September, December, and then the day before April 14th, and it just skyrocketed. So stress will stimulate your body to make cholesterol. Now, hopefully, now that you're sitting here and everything's looking good, it's going to go down. The only other thing is you have to be careful to have your thyroid checked, because sometimes if your thyroid is off, it also will raise cholesterol. Okay, now I lost my train of thought. That's all right. That's right. Okay, so your total cholesterol should be less than 200, and your bad cholesterol should be less than 100. If anybody in here is diabetic or has had a problem with their heart, really the bad cholesterol should be down under 70. We want it really low. And the good, healthy one, think of that healthy versus lousy, should be above 50. Now, some of us are blessed with genetics as women, mainly women get this, where your HDL, the good one, is very, very good. And you didn't do anything good to get that. Mine is over 90, and I was just born, and I think that's why my mother lived to be so old, is that hers was very high also. Then some of us are not blessed, and you end up with I have one patient who his HDL is 8. And he has disease up here in his carotids, he has coronary disease, and he has it in his legs, his vessel. He's filled with it. And he's a vegan. He doesn't eat any animal products whatsoever. But he's got a genetic problem with his body not producing good cholesterol, so we have to put him on medication to protect his vessel wall. All right, so triglycerides. Anybody in here have a problem with triglycerides? Okay. I'll tell you how to handle the next lab test. In a way, this is cheating, but at least it kind of gives you a good idea. Triglycerides go up with refined sugars and carbohydrates, as in bread, rice, pasta, and potatoes. So the day before your lab test, if you do not have any bread, rice, pasta, potatoes, chocolate, refined sugars, and the morning of your lab test, if you go out and you walk for as much as you can, preferably like an hour, and then you go have your test done, you can lower your triglycerides 100 to 200 points. Mm-hmm. Now, those of us that have normal triglycerides, nothing's going to happen. But if you have a body that makes too many triglycerides, it's very dramatic. Now, it's cheating in a way, but it kind of gives you an idea what food and exercise does to lower it.
But mine goes up and down because I have a thyroid problem.
Well, then you need to be on the right medication to regulate that. But some people have their pancreas they have a real. I have one patient who from 29 Palms who actually was had to leave the service because his triglycerides were 13,000. So it's a metabolic disorder like diabetes. So this cholesterol that we make that travels all over our body, it can't go by itself. It has to be attached to what we call lipoproteins. So I'm going to give you something so you'll be real intelligent when you leave here. So lipoproteins, if you think of it like a train and cars on a train, are how it's transported throughout our bodies. So the term HDL and LDL, the HDL means high density lipoprotein. That's what the HDL stands for, and LDL is low density lipoprotein. And the reason I have this up is that there are other lipoproteins besides the one you're used to, and one of them is called VLDL, very low density lipoprotein, and this is if you have very high VLDL, and it's a separate test that's done, that's very dangerous. It's extremely athogenic on the wall of the artery, and it can break it down. So sometimes when we have someone that they do everything right and we can't figure out why they have such terrible disease, we look at the VLDL. And then there's another one called IDL, which is intermediate density lipoproteins, which is really bad also.
Sally,
Yes?
what is the role of lipoprotein A?
Okay, now that's different. Apoprotein A, that is looking at the actual molecule itself of the lipoprotein and seeing if it's big or little and how it, the whole process of how it's going through your body and crossing the cell wall. And if the size is abnormal, it can be extremely, when I say atherogenic, it means that it's extremely harmful to the wall of the artery. But that's a specialized test we run to make sure everything in your metabolic system is the normal amount.
But can it be that your cholesterol, the level is good, is normal, but then your lipoprotein A can be high?
You mean your ApoA?
Yeah.
Yes. And that's a metabolic issue. That most people, you have to do special testing to see if there's something wrong with the way the whole process is working. It's very, very involved. Okay, so when you look at your label, your food label, it's important to look at both the cholesterol and the saturated fat. Now, the saturated fat, I can't say this enough, is animal saturated fat, not plant. So how many of you have a jar of peanut butter at home? Okay, so go look at the peanut butter, and if you look at the label on the peanut butter, is there going to be any cholesterol in it? No. Why? Yeah, yes, she said, somebody said it, plant. You only find cholesterol in the animal world, all right? So if you have something that does not have cholesterol in it, it's not going to hurt the fat in it, because peanut butter is loaded with fat, right? It's not going to be on your diets, but it's not animal. So when you, as women, increase your plant fat, if you're going to have a lot of fat, if you just would have plant fat, like peanut butter, avocados, nuts, olive oil that they're selling downstairs. It's fattening, so you have to be careful how much, but it's not going to hurt your heart. Okay? So when you look on the food label and it says it has no cholesterol, it means that the fat in it you've got there is a plant-based fat. So we want you to have less than 300 milligrams a day. Does anybody know what's in a yolk of an egg?
More than 200.
Yeah. One yolk, and you've done it for the day practically.
Although I have seen some of the eggs, they have 175, 185, some of them. You have to look.
Well, the safest is to just use the whites. Or if you're going to have several eggs, just what I do is if I'm making scrambled eggs, I just dump the yolks and use like one, or if I have for like 2 or 3 people, I'll use a whole bunch of whites and just half the yolks. I had a lady that gave the yolks to her dog and the dog died. So she was having a lot of trouble throwing them in the trash. So don't do that. Don't give them to your animals, because they can still get heart disease too. If you've had heart disease or you have diabetes, they really want you to get your numbers down. So they want the cholesterol less than 200 a day, and the best animal saturated fat is none. The limit is 1 gram, not just per serving. Really try to keep it down of the animal saturated fat. So here, you know what's really interesting? How many of you in here would just give anything to have a steak? This is just fascinating to me, because for the last 25 years, I've dealt with men and women with heart disease. What about dairy? Okay, all of it says this is our down. Cheese, my downfall is cheese. Yeah, for me to give up. Okay, so we're kind of down on this lower. We're on this lower level where men, they'll say, oh, I don't eat cheese, but a steak, wow. So the main thing is, we're not safer, we're not better, it's all the same. The artery doesn't care whether you got it from a steak or you got it from the cheese. It's exactly the same. So the important thing is to just keep it down at a minimum. So what I do is, I have this thing, I love quesadillas, but I use hummus most of the time until I'm having a complete meltdown, and I save the cheese for when I can't stand it anymore, and then I just have the cheese in the quesadilla. So, I guess my little pointer is up there. What I wanted to point out, this picture, this is taking one of the coronary arteries and cutting it in half. And what we used to think was that as the plaque built up in the arteries, the wall here stayed intact, and the plaque just went in. This is where the blood is flowing through to the heart. And we used to think that the plaque just built up in here, so that when you went and had an angiogram and the doctor said you have 25% plaque, you have 50% plaque, it meant that this was still okay, but the plaque was just interfering with the blood flow to the heart. Now we know that's not true. The reason you can have a heart attack and not have any symptoms is because the plaque, when it first developed, goes this way. And it's down here. So you can have this huge, huge, what we call endothelial wall that is awful. It's just terrible. And you go in and you have an angiogram, you have a stress test, you have an EKG, and everything's normal. Everything's fine. The doctor says, you're good as, there's nothing wrong. And that's because when they do the angiogram and they put the catheter in, all this is fine. You're getting plenty of blood to your heart. They can't see here. They can't see what's going on. So if that is what we call unstable plaque, it can rupture, and the clot can block the blood flow later on, further down the vessel. And you can have, do you remember Tim Russett, the newscaster? Well, he went in, had an angiogram, he had a complete workup, he was going overseas, he went over, took his trip with his family. I think they went to Ireland. He came home the first day on the job. He was at work. He stood up and he threw a clot. And he just, boom, like that, he was dead. He had a complete workup. So this is where it becomes very important about the saturated fat from animal products. That's what does the damage down here. That's why we try to get people to be careful. This next picture is looking at that inner wall of, this is the blood vessel, this is the endothelial, and this is all the different layers. So when you have a diet that's high in animal saturated fat, you damage all these different layers of tissue, and it becomes this awful engorged glob. And if you keep eating the saturated fat, it can rupture and you get in really big trouble. So this is just looking at the comparison of, on a food label, of sausage, bacon, milk, ice cream, of cholesterol to saturated fat. And what I find really interesting is, look at the, if you were just looking at cholesterol, couldn't you eat every single one of these things? If your limit was even if you're a heart patient, even if your limit, was 200 milligrams a day. This is why it's so important that you not just look at cholesterol, you look at saturated fat, because that is really the main killer. That's what.
Fish and chicken.
Chicken is very lean, and it's without the skin, because the skin's where the animal has its fat. But it doesn't really have anything that is healthful to the heart, where fish actually has, the oils in the fish is very good for your heart. So if we as women would serve tuna, halibut, salmon, just more fish rather than so much chicken, you're actually helping your heart. Now these are the three things, the three exceptions that are on most diets, because if you look at this is the reverse. This is where they have no saturated fat, but look at the cholesterol. So egg yolks, liver, and shrimp or shellfish are the three things that don't have fat on them, so they're on diets, but they're loaded with cholesterol. So if you have a problem with your cholesterol, you want to stay away from those three foods, because it's really going to bump your number up. So let's talk about the good healthy foods, and that's the fiber foods. So anything that doesn't have a mother is very good for us. And here are the plant fats. You just have to be careful about the volume of the fats. Now, the American Heart Association has come out. How many of you are familiar with all the talk on antioxidants and how important they are for us? Well, the good news is that all the foods that are good for you, for your heart, are also very rich in antioxidants. So when you have beans and rice, and you have the whole grain foods, the fruits and the vegetables, these are very life-giving foods. They're very, very good for you. Now let's talk about exercise. And since I've been doing this for so many years, I find this is the hardest thing for me to motivate women to do, because we don't want to sweat. And all this saying that it's going to make you feel so wonderful, most of us, now maybe there's some in this room that really are good at exercising, most of us never ever really feel good getting out of bed or whenever you're going to do and exercising. And it never gets better. That's what I found. Now, I've been exercising all my life, but it's never gotten better. It's still hard for me to get up and do it. And I have to get up at 3:45 to get it done, because I have to be at work at 7:30. So, but it's really, really important for your heart. And I think it's also very, very important for us as women, as mothers, to motivate our kids and our grandkids that if we can do it, they've got to do it. Because we've got a whole population that doesn't have PE, that are sitting at computers, and there's terrible, terrible things happening. We're seeing with the youth of today because they're just not exercising like we were brought up to do. So if you don't have heart disease, if you have heart disease or you have someone in your family that does have heart disease and you don't exercise, the studies that we're finding is that people are dying prematurely of heart disease once they've been diagnosed with it when they don't bring exercise into their life. But if they do exercise, exercise just does wonders for the body. It helps decrease body fat. It decreases your blood pressure, your blood sugars, your cholesterol levels, triglycerides. It bumps up your good cholesterol, and it actually improves the wall of the endothelial, of the artery wall. It actually has very much healing properties in it. And a lot of the studies that have been done show that for every 1% that you bump up your good cholesterol, you decrease by 2 to 3% heart events, heart attacks, bypass surgery, all the things that we don't want to have. Now, aerobics and your heart. Of course, you know when you do cardiovascular exercise, you're stimulating your body to circulate your blood. You're just doing all these wonderful things for the heart itself. And it's important to kind of understand as women that when we do certain things, it's for our heart, and then when we do other exercises, which are anaerobic exercises, it's very good for our muscle tone, but it's not really what's going to help the heart. So we want you to do a combination of the brisk walking. I do curves several times a week. I like curves. They open it up in Riverside for me at 5 in the morning, which I really can't thank them enough to do so that I can get down there. And then on the other days, I either walk or run with my husband. But the combination, and the older we get, it just strengthens our body. It makes us feel better, and after we get done, not during it. I still don't enjoy getting up early and doing this, but you know, it's the way it is to make yourself stronger. So you have to figure out what your goal is. If your goal is for cardiovascular fitness, you want to do an aerobic. Muscle strength is anaerobic, and flexibility is anaerobic. Weight loss is aerobic. Muscle toning is anaerobic. Stress management is aerobic. Increased energy is aerobic. So the best thing is to find something that you like and to find someone that you like to do it with you. I hate this really dates me, but back in 1985, I joined the Loma Lopers, and I got really close friends with a lady named Nancy who still does my hair, and we still run together. And all these years, we have gotten up and run. We did several marathons together when I was a lot younger. And she really helped me when I didn't want to go out. She would be at my door to run. When she didn't want to go out, I'd say, Nancy, we got to do this. And even to this day, we're still motivating each other that we've got to keep going. Every time I go get my hair done, she goes, now what race are you doing next? And now we used to do half and marathons. Now we're down to 5Ks, but at least we're doing something. So the best exercise, even if you just walk, anything, but you got to do it every day. Not 3 times a week, but every day to really get the benefit from it. And it becomes a habit. So let me talk a little bit about the statin medications that came out about 25 years ago. They've really been a blessing in my field of cardiology. When we had patients come in with terrible, terrible heart disease in the past, 25 years ago, we couldn't offer them any hope. We'd do surgery, they'd go home. About 25% of the patients we operated on, they would die. And we knew they were going to die. But once the statins came out, the statin medications have a healing effect on the wall of the artery that you can't get from anything else. So when you put someone on a statin medication, the reason the doctors love it so much is it actually heals the coronary artery. How they work, besides that effect, is they tell your liver to not make the cholesterol that it wants to for that day. So every day that you take a statin medication, your body pulls out of your coronary artery the LDL and recirculates it. So you take it and you get a drop in your cholesterol. If you don't take it, the very next day your body goes back to making the same amount of cholesterol that it wants. All right, so when you've had a heart attack, when you've had bypass surgery, or you've got these terrible, terrible cholesterol numbers, and you've done everything, but you're just stuck because of your genes, they really are a blessing for patients that need them. And I put 2 other slides in. This is just what we were just talking about. These are all the effects when you take a statin medication, Lipitor, Zocor, Pravachol, Crestor. These are all the effects that the medication has on the wall of the coronary artery. There's actually a chemical event happening on the wall. And if you take a patient like Bill Clinton, our president, that has terrible, terrible disease, or Dick Cheney, just terrible disease, and you put them on a statin and you talk them into being a vegan, which Bill Clinton became, you can actually show as the years go by that his vessels are healing. It's just phenomenal. It takes a long, long time. It doesn't happen overnight. It takes years. But you can reverse the process of the damage with the combination of a vegan diet and the statin. And they're safe. They were tried at the VA hospitals when they first came out. About 2% of the population cannot tolerate them, but worldwide, they've been extremely effective. So in summary, we try to prevent heart disease at all possible by avoiding animal and dairy saturated fat, exercise, keeping your blood pressure under 120/80, your sugar under 100, fasting sugar, your LDL bad cholesterol less than 100, not smoking. And if you've had heart disease is present, careful monitoring by your doctor, educate yourself on the signs and symptoms, adhere to a regime like cardiac rehab. How many of you know what the main sign for women having a heart attack is? The symptom. If they're going to have a symptom, does anybody know what it is? Okay, that is one of them, but it's not the main one. So for men, it's that crushing, that elephant on their chest, you know, jaw pain, whatever. For women, it's unusual fatigue. And how many of us don't get tired? But the tiredness is not just we're tired. It's an overwhelming fatigue. It's a fatigue where you can't even get up out of bed. And what that is it's the heart muscle is in big trouble. It's not getting enough blood. And so the fatigue is the heart is saying, I'm sick. I can't get enough blood to let you get up, get dressed, and go about your work. And what do we usually do as women if we are really, really tired?
Get up and do it anyway.
Yeah, either that. But if we couldn't, a lot of us take a nap. Do we go to the doctor? No. We send our husbands, everybody else goes to the doctor, and we take them to the doctor, but not us. So, you know, this is really important to, if you're having, and I'm talking about just extreme fatigue, that you just cannot function, and that is the heart. I did a talk for a Rotary Club there. The whole room was filled with men, and it was on women and heart disease. But I gave my talk, and that night, one of the men was at Chuck E. Cheese with his mother and his family. And his mother was sitting there next to him, and she said, gee, you know, I'm so tired. I just want to go home. I'm sorry. I just can't do this anymore. And she didn't smoke. She was about, I think she was in her early 50s. She didn't have any risk factors, no high blood pressure, no previous heart disease, nothing. And he turned to her and he goes, Mother, you know, just try to make it through. And then she goes, no, I can't. I have to go home. And he goes, Mother, I just heard a talk today about women and heart disease. We're going to the emergency room. We're not going home. He took her to the emergency room at Loma Linda, and she had 5-vessel bypass surgery. And the surgeon, Dr. Razouk, said she would have been dead by Monday morning if he hadn't brought her in. So, you know, and this was a slender, no risk factor woman. She was filled with disease. And the reason for that is those coronary arteries, the plaque, the artery is 4 times bigger than you ever need. So theoretically, you could have a lot of junk in there and still have plenty of blood flowing to your heart that you don't know there's a problem. But the minute that it blocks off, you're in big trouble. And that's what happened to her. She had a minimal amount of blood. It was getting thicker and thicker. And, you know, without the bypass surgery, she would have been very, very much in trouble. So do everything you can to slow down and reverse the progression of the disease. Though here are the symptoms for women: unusual fatigue, new and unusual shortness of breath during everyday activities, nausea, dizziness, lower chest discomfort, back pain between the shoulders, upper abdominal pressure or discomfort. And then here for men, you notice we have a different: sweating, nausea, lightheadedness, changes in pulse, breathing difficulties, changes in skin appearance, crushing, that like an elephant sitting on their chest. So thank you, ladies.
Thank you.